Wadiya will remain a dictatorship.
January 2023, the President of Zimbabwe, Emmerson Mnangagwa, signed a new law that threatens healthcare workers with up to 6 months in jail if they go on strike. This new legislation has raised concerns about the government's respect for workers' rights and their ability to provide adequate healthcare to citizens. The new law is called the Health Services Amendment Act 2023, and it amends the Health Services Act 2816. According to the new law, any health worker who goes on strike, whether individually or collectively, will be liable to a fine or imprisonment for a period of up to 6 months. The law also makes it illegal for any person or organization to encourage or facilitate a strike by healthcare workers. The government claims that the new law is necessary to prevent strikes from disrupting healthcare services, which are already under strain due to the COVID-19 pandemic. However, many healthcare workers and human rights organizations argue that the law violates workers' rights and could lead to a worsening of the already dire healthcare situation in the country. Zimbabwe's healthcare system has been under significant strain for many years, with a lack of resources, equipment, and qualified staff contributing to poor health outcomes for citizens. The COVID-19 pandemic has exacerbated these issues, with hospitals and clinics struggling to cope with the surge in cases. In response to these challenges, healthcare workers in Zimbabwe have gone on strike several times in recent years, demanding better working conditions, higher salaries, and more resources for the healthcare system. These strikes have often been met with hostility from the government, with healthcare workers being threatened with dismissal, arrest, and even violence. The new law has been widely criticized by healthcare workers, human rights organizations, and opposition politicians. Many argue that the law is unconstitutional and violates workers' rights to freedom of association and assembly. They also point out that the law is likely to exacerbate the healthcare crisis in the country, as healthcare workers who are unhappy with their working conditions may be more likely to leave the profession altogether, worsening the staff shortage. The law has also been criticized for its potential to stifle dissent and suppress criticism of the government's handling of the healthcare system. Human rights organizations have raised concerns that the law could be used to silence healthcare workers who speak out about the inadequacies of the healthcare system or criticize government policies. The government has defended the law, arguing that it is necessary to ensure that healthcare services are not disrupted and that patients are not put at risk by strikes. The government has also stated that it is committed to improving working conditions for healthcare workers and investing in the healthcare system. However, many healthcare workers and opposition politicians remain skeptical of the government's intentions. They argue that the government has a history of ignoring workers' rights and suppressing dissent, and that the new law is just another example of this. The new law has also drawn international attention, with human rights organizations and healthcare groups calling on the Zimbabwean government to repeal the law and respect workers' rights. The United Nations has also expressed concern about the law, with the UN Special Rapporteur on the Rights to Freedom of Peaceful Assembly and of Association, Clement Nyale-Zosival, calling on the government to engage in dialogue with healthcare workers and respect their rights. In conclusion, the new law signed in Zimbabwe that threatens healthcare workers with up to 6 months in jail for going on strike has raised concerns about the government's respect for workers' rights and their ability to provide adequate healthcare to citizens. While the government claims that the law is necessary to prevent strikes from disrupting healthcare services, many healthcare workers and human rights organizations argue that the law violates workers' rights and could lead to a worsening of the healthcare crisis in the country. The law has also been criticized for its potential to stifle dissent and suppress criticism of the. Zimbabwe is a country in southern Africa that has been plagued by corruption for many years. Corruption is deeply rooted in the country's political, economic, and social systems, and has had a devastating impact on its citizens. In this 800-word summary, we will explore the various ways in which Zimbabwe is corrupt. Corruption in Zimbabwe is often traced back to the early 1980s, when the country gained independence from Britain. At that time, the government was dominated by the Zimbabwe African National Union Patriotic Front, ZANU-PF, party, which was led by Robert Mugabe. Mugabe served as the country's president from 1987 until he was ousted in a coup in 2017. During his time in power, Mugabe oversaw a vast network of corruption that permeated all levels of government. One of the most notable examples of corruption in Zimbabwe is the looting of the country's diamond mines. In 2008, the government allowed foreign companies to mine diamonds in Zimbabwe's Marange region. However, the diamond revenue did not benefit the country's citizens, as the government siphoned off the profits for personal gain. According to Global Witness, a non-governmental organization that investigates corruption and human rights abuses, at least $2 billion in diamond revenue has gone missing in Zimbabwe since 2008. Corruption is also rampant in Zimbabwe's public procurement system. The government awards contracts to companies without a competitive bidding process, often resulting in inflated prices and substandard work. This has led to the construction of shoddy infrastructure and the purchase of overpriced goods, leaving Zimbabwe's citizens with inadequate public services. The country's health system is particularly affected by corruption. Hospitals and clinics are understaffed, and medical equipment is often outdated or non-existent. Corruption is partly to blame for this situation, as government officials and health workers frequently embezzle funds that are intended for healthcare. This has had disastrous consequences for Zimbabwe's citizens, who are often unable to access even basic medical care. Another area of Zimbabwe's economy that is plagued by corruption is agriculture. The government has a long history of seizing land from white farmers and redistributing it to black Zimbabweans. However, this process has been marred by corruption, as government officials and their allies often seize the best land for themselves. The result is a farming sector that is inefficient and unproductive, leaving many Zimbabweans without enough food to eat. Corruption in Zimbabwe is also evident in its electoral process. Elections are often marred by irregularities, including voter intimidation, ballot stuffing, and vote rigging. Opposition parties are routinely harassed and intimidated by the ruling party, and the media is heavily censored. As a result, Zimbabwe's citizens are unable to fully exercise their democratic rights, and the ruling party is able to maintain its grip on power. Zimbabwe's police force is another area that is rife with corruption. Officers are often paid meager salaries, leading them to accept bribes from citizens in exchange for turning a blind eye to illegal activity. The police force is also heavily politicized, with officers frequently harassing opposition supporters and ignoring crimes committed by ruling party members. Corruption in Zimbabwe is not limited to the public sector. The private sector is also plagued by corruption, with companies often engaging in bribery and kickbacks in order to secure contracts and influence government policy. This has led to a business environment that is difficult for honest entrepreneurs to navigate, and has deterred foreign investment in the country. Zimbabwe's corruption problem is not a new one, and has been exacerbated by decades of mismanagement, cronyism, and nepotism. The country's leaders have shown little interest in tackling corruption, instead using it as a means to maintain their power and enrich themselves. Despite these challenges, Zimbabwe has significant potential for economic development. The country's natural resources, if managed effectively, could generate significant revenue for the government and private sector. Zimbabwe's strategic location in southern Africa, with access to several major transportation routes, also makes it an attractive destination for investment. Overall, the future of Zimbabwe remains uncertain, but there are signs of hope. If the government continues to implement reforms, address corruption and human rights abuses, and invest in key sectors such as agriculture and infrastructure, Zimbabwe could achieve sustained economic growth and development in the coming years.